launch us into our presentation. And as always, I'll start and then I'll be turning it over to other members of my staff to continue the discussion. So let's go ahead and move on to the next slide. Go ahead, advance it one more. So a few things that I want to go over with you, just to let you know, and I've been in my email as of today. I don't have a 45-day notice, so we know we are not 45 days away from our first review because we have not received our 45-day notice. But we do know that at some point very soon we will be receiving that. We've already started our work and working with the 5 agencies that would be the first who would go through an FA2. And those are the ones who are funded with our EHS expansion grant because it is in its 3rd year. We have engaged with consultants and our teams have been working with our 5 subrecipients. We have conducted an ERCIA file review. There is some additional work that's being done regarding those files. And we also have given to each of the agency a content area specific template to really sit down, ask yourself some questions about how you operate, how you adhere to performance standards. What are your systems that are in place? And what is your understanding of what is expected from you, from us as a grantee or recipient of these funds? And so everything that we're doing with the first 5, we're going to be putting together systems and we will be implementing the same work across everyone else as we move forward. And so what we do know is the next fund or grant that is up for an FA2 would be EHS-CCP. And so we will be starting to do some of that same work, engaging and using these same systems with those of you who would be next in line. And so what we're trying to do is put together our system and our approach because we know we've got 3 years of federal reviews ahead of us, starting in 2022, then in 2023, 24, and also we know by then or anticipate by then that we will also have class observers within our programs as well. And so again, we've started our process and we'll continue to do so. And we will be bringing some of these same tools and supports to others as we move forward. This is specific to federal funding only. But what we are finding, and I just want to say a couple of trends so people can start thinking about it. And you can send emails to us and definitely to individual team members who work with you on ERCIA. What we're finding, for example, is that there is a rule that actually has been on the books since 2017 regarding our ability to, when we enroll families, that we're actually adhering to what's called relevant time period, which is about a year prior to that family being served in your program and looking at what was the income and stability of that family. It really is about looking at the family to see how they have been able to survive thus far, to give you some insights on the kinds of supports that family may need now that they've enrolled in your program. I know those 5 subrecipients who are working on this have had time to go through this. We'll be going over this with others of you as well, making sure that your current eligibility process adheres to that rule. So you're going to get some information very soon. And that's why I'm just giving you a heads up. You will be getting some information so you can start looking at some of your eligibility files regarding Head Start, Early Head Start expansion, and also Early Head Start CCP. And again, the templates that we're using, we're going to be using those for all of you. Right now, we are having the 5 subrecipients work on theirs. We will be giving those to others as we really look at our system and make sure what we're passing forward, that we've polished it and that we have everything in place for you. So more to come on FA2s. You're going to hear from me every time we're together about underutilization of grant funds. Our funders are on us, wanting to make sure that we're able to be good stewards of our dollars. Good stewards of our dollars mean that we're using them and that we're not turning them back. We are now March 17th of 2022. We only have 3 months left on ECBG. And what I do know on that fund is that we're underutilized. Some of you have said that you are going to do budget revisions. If you have not, you need to do those right away. The reason I'm saying that is this. Right now, what we know from our funder is they have to look at that fund at the end of this month, because in order for them to make a determinant about any dollars that they need to reallocate, move, or change, they have to do it by the month of August. April. Too many A months. The month of April. And so if they're doing their due diligence in the month of April, I need you to do your due diligence now. If you're needing a budget revision, you need to be submitting it. You need to have it in the queue so that we know what your plan is in order to utilize your dollars. We're going to be reaching back out to people, and we see that there's underutilization, and we're going to have to make some internal decisions about what we're going to do regarding those dollars. Because again, our being good stewards means that we're not leaving another $12 million on the table as we did in the last fiscal year for our early childhood block grant. We understand where we are with our Head Start, Early Head Start CCP, meaning that those grants started December 1. But I just want you to stay on task and on target and make sure you're utilizing those funds as well. Because again, we don't want to turn any money back to the federal government either. And so you are going to be hearing us constantly talking about where we are. And I know later in this presentation, people will be talking to you about it. But I really need you to be in your house and looking at what you're going to do about utilizing dollars. And when we're talking to you, let us know what the reality is. I know, and I'm just going to say this and be very transparent. There's been many times that we would talk to people and they would immediately say, yes, we're going to use all of our funds. And I'm sure you were planning for that. But what would happen at the end of the grant period is all the dollars weren't left and they were left on the table. And so what we're asking for is you to be realistic about what you're going to actually be able to use when we're talking to you. And if you anticipate leaving any, we need to know that now so that we're working internally where we have some ability to move funds and do some things with it, and or making sure that we're able to communicate that to our funder. As always, if you've got questions for me, reach out to me, we can talk it through, but we cannot continue to underutilize the funds that are given to us. Those dollars are for you to use for children, families, and your staff. And we really want you to maximize those and use every dollar. So yes, it's me on my bandwagon. And every time you hear from me, I'm going to be on that bandwagon. And I'd love to be celebrating at the end of this, that we really did maximize these grants and used all of our dollars, because that's what we should be doing as good stewards. Change management. I'm going to go into some slides and talk to you about our new data system, which we are working on. We're working on multiple vendors who are working with us to stand up a new data system. Someone asked before, it is going to be within Salesforce, and that's what we're working with, but our vendors are working with us. One of the things that we do know is when you're standing up something as large as a brand new data system, it takes a lot of work. We're learning that on our side, of course, with all the time and effort that my staff are spending working with vendors trying to get this done. And our IT team here in DFSS are working with this. But with that said, we also have to make sure that on your side, that your staff are ready to be the recipients of a new data system, which means they need to understand what we're doing. And so we're launching into communication systems and change management systems to make sure that we're able to give you the kind of information that we hope will aid you in your communications with your staff who are going to be using this new data system. There will be a time when we will have both systems up, meaning our new Salesforce system will be up, and at the exact same time, we will still be using our COPA data system. And so knowing that staff are going to be a little skittish about having two data systems that they have to work with, I want us to get ahead of that so that we can have the kinds of conversations necessary so that we can allay some fears. We can work with people to give them better understanding of what all of this is. And once we're moving further into this, we'll be able to get them to a point where they're much more comfortable. But the greatest thing that we want is for them to be much more confident in their working with these new systems. And so we understand what it takes and what it's going to take for you. And we want to be your help agent in this and making sure that we are distributing and working with you on tools to help you on your side with this. And so lots more information. We're going to have a few sessions where we're only going to talk about the data system, and we won't drive deep into a lot of other topics because we will want to give you all the information that you need about what it is that we're doing on this side. I'm going to cover the last dot point on here, and we are seeking a manager. And it is the program operations and quality team who that person is responsible for. Just want to make sure, because I did hear from some people that they saw it. Yes, it is out there. It's on the Chicago website. And what's right here for you is the link to that website. I'm not trying to steal your staff. Please, everybody understand that. But once things go up on the website, people do see it. We can't keep it hidden. It's public, people. And so I may as well be public with you as the public site is open, letting you know, yes, there is a position that's up on the website right now. And we are seeking a manager for our program operations and quality. We lost our manager in the fall of last year, and we are looking to hire and replace that position. So yes, it is up there. The link is there. Next slide. And so some of the things we're going to be doing is talking about, as I was alluding to about the new data system, is organization change management. Because what we understand, in order for people to really feel comfortable with us, we have to be proactive in our work. We've got to be listening to them and you have to be listening to them as their concerns are raised. And we will be working together to deliver this, because what we understand is we see this as a benefit to all of us, because what it's going to allow us to do is to have a much more iterative system that's going to allow us to do our work in data that supports our children and all of their families around Chicago. What we know is there were some things in COPA that we could not change, and we could not get it to the point where we needed it to be. And so we are designing a whole new system. One of the things that this system will do, for example, as your staff are putting in family files, there will be blocks in it that will stop them from advancing until they actually complete all of the required fields. Because what we do know is people put in some parts of the fields, but they don't put them all in. And then when it's time for reporting, we're constantly chasing behind your staff, trying to get in all of the other information that's needed. There are going to be some pieces of this work that's going to stand outside of this system, because we get updates, for example, to our ISBE report, and we won't be changing systems as we need to. But one of the things that it's going to do is going to say, you know, you can't complete this, you can't go further. There's going to be that block. Thank you, Gwen, for saying that. Yes, it is a great feature. We wish we had that feature in our current system, and we wouldn't have so many blank fields. But what we're hoping now with this new system is we'll be able to have you understand on your side that your records are complete, and then we will be able to pull down complete records on our side. And your staff will need to understand that. And so again, just that change in and of itself is something that is a change management issue on the hands of those who are going into your system. When they get that first block that says, no, you can't go any further, if that person hasn't been made aware of it, they're going to be going, what am I supposed to do? Well, what we are asking them to do is complete the file, answer all the required questions before they are moving forward. If they need to go back and get something from a parent, which they may need to do, if there's some incorrect information, it will catch that. And so we're wanting a system that's going to really work better on your side, and definitely is going to help my staff on this side. But we got to work together to get this done. And so we're now at a point where we're going to be engaging many of you in this process. And there's some resources that are in review right now that will be available the week of March 21. And some of those resources are going to help you be able to talk to your staff and help you understand more of what's going on. Our team is finalizing what we're called the solution. When you stand up something like a Salesforce program, you get to give it a name. And so we're finalizing that as we speak. And we will be sharing that with you as well. There's some testing that's going on. System administrator user acceptance testings. We have some of that that's scheduled for April 6th. And we do know that we've been reaching out and getting some people in doing some of the work right now. And we're going to continue to do that. And we will be expanding more as we move forward in this. And so if you've not been touched and we haven't called, or no one's reached out to you to ask a staff member of yours to do any of this, look at this, it's because you want to look at have a few people at the first table, and you expand out from there, because it just some of their first pieces of what they saw actually went back to the vendor to say, yeah, we do need to already tweak that. And so we're doing some of that as we go, and we'll continue to do so. There will be some systems admin trainings that's going to come up the week of April 9th through the 12th, which means those of you who have staff on your side who are considered systems admin, by May, we're going to be ready to start training them on this system. And some of what they're going to be trained on is going to help them understand what this looks like and how it's going to be used on their side. And so how to get into it and all of those pieces of information. So as you can see, we're driving forward with the development of this new system. So lots more to come. Next slide. And so some key dates again, Thursday the 17th, we've asked for and need 6 to 10 delegate agencies to provide some change readiness insights. In other words, where are we? How are your staff thinking about a new system? If you've mentioned it, what did you already hear back? And so we want to really spend about an hour. The organization or this OCM team wants to spend about an hour with you talking over and trying to think about what kinds of things that we may not have thought about that we need to be thinking about. How do we help make sure that people are ready for this huge shift and this huge change? Change is not easy for some people. Some people, even if it's a bad system, would rather have a bad system than have to change to a new system. So we know you're going to hear some of that on the other side. So how might we work with you? What else do we need to know? How else might we be able to help you? And so what it is let us know. If you would like to contribute by shaping this, let us know in the chat if you think that this is something you want to do. So put your name in the chat, letting me know. And what you're saying is that, yes, you would like to have you be one of those delegate agencies that we work with on change readiness. So you can say in the chat box, CRI, in other words, change readiness insight, and then put your agency name for me. So I know that you're saying this is something that you like to work with. So go ahead, get into the chat so that we can get some of those agencies. I see. Thank you, Nina. Week of 321, you're going to get an email from me. And I know you guys get emails from me, and then you get CSD update. We're going to continue to work with you, but you're going to get an email from me with information on how you can access this digital hub that's being stood up for you. One of the things that I'm saying to you is we want you to communicate. We try to over communicate, and I know we give you probably more than you want sometimes, but now we're adding more. And so we're going to be sending you some information in an email that you can use to communicate with your system admins, helping them understand some of the upcoming trainings and everything that they'll need to do to register and all of that. And so prior to 5/9, you're going to get some registration updates, but you're going to get an email from me so that you can start the communication with your system's admins. Don't want to wait till the last minute to do this. Trying to get people on board now, get them ready for change. Change is hard. We want to work with them now, and I'm going to work with you to work with them, and we're going to do everything we can to get through this. So when we say it is live, and there's going to be a day where you're going to get this big blurb that says it is live, which means Salesforce is now fully loaded. It is live. It is our new system. I can't wait for it, by the way. But when we finally stand it up and say that, what I want on your side is for your staff to be clapping just like the staff on this side will be. In order for us to do that, we got to communicate, communicate, communicate. And I'm calling on you for collaboration through this process. It's been a lot of work on my team side on just getting us through to the point where we are. And I commend them, I commend them, I commend them for everything that they've been doing. But we've got a lot more work ahead of us in order to drive this thing to full implementation and then standing it up. Now I'm asking you, please participate and work with us. Then the week of the 28th is the first series of 1 hour's Be in the Know, which are some interactive sessions. It's going to be available to all of you. We're going to give you some time. We're going to arrange the time, but the agenda will include, as it says here, there'll be some project updates, some engagement feedback, readiness canvas insights, resources. What we're going to give you is FAQs, all kinds of information. We're just going to try to give you everything that you need in order to be able to keep this communication going on your side. One of the things we will be standing up will be a place where you can go in and you can get all this information. It won't be from me directly. It will be through the system that we're standing up. So you can access and have information to share on your side. Thank you, thank you, thank you to all of you who are saying yes in the chat box. I see them popping up in my face here. So thank you, everyone. Next slide. And so why readiness? Again, some of the things that I've just said to you, if we don't talk to people, if we don't give them a heads up, and all of a sudden you drop in their lap a new system and say, oh, by the way, now this is what you need to sign into, you're going to have people losing their mind on your side, because we ask for a lot of data entry and we recognize that. And so especially when this period when we're going to go through and both of them are going to be out there and active at the exact same time, what you're going to find is they're going to be screaming, how do I do this? And we want to work with you so that we can communicate all of that and make sure that they understand exactly what this is now. getting their mind set that we're doing everything we can to make this as easy as a transition as you possibly can when you're moving from one data system to the next. Getting some insights from all of you on things that we need to think about, tweak, and have in that communication stream is why I'm talking to you this morning about this. Some of the questions that, awareness, are, making sure that your staff, and I know staff changes. And so through this process, the thing that I will be asking you to do is if you bring on new staff that's going to be impacted by this, that you quickly let us know that, because what you don't want is a brand new staff member who's already a little skittish about the work that you're putting in front of them. And then you say to them, and oh, by the way, next week, you're going to change from one system to the next. And so let's work this together so that everybody's on top of communication and can make sure that we're doing everything that we need to do on this. We're going to give you support for this change, and we're asking you to support your staff, but we're going to give you supports to make this work. We're going to talk about, the knowledge level and proficiency level that's needed in order for this new solution. We recognize this won't be something that they've used before. That's why I'm saying we got to go through training. Everybody's going to be trained on this. There'll be times that I'm going to be asking the vendors to be here with us in these meetings to specifically talk about this so that you're ready. What is it that we need to put in there? What else do we need to do? What else is needed? What other collateral? What else do we need to bring to the table to drive this whole thing home? As conversations we'll be having with you. But again, it's not going to work. It's going to be a big issue if people aren't communicating. We talked about this in the last meeting. I'm hoping that you're already saying to people, DFSS, Children's Services Division, is building a new data system. That new data system will replace COPA. I know you use COPA right now. Sometime in 2022, we're going to be moving to Salesforce. Say it, talk about it, make sure that they know. Let's not get down to the point where we're ready and we're saying, okay, we're ready to go live, and staff are going live with what? That would be the worst thing that any of us around the city of Chicago could have done, because we need you in this system and we need your staff in this system. I'm going to stop talking. I'm going to make sure that you understand you're getting emails. As I said before, we're asking for agencies, and I thank you again. I see Rainbow is saying yes, that agencies involved in this so that you are testing and you're getting information and you can see some parts of this. We're going to be asking you to let us know what else you think we need to do. What else do we need to say, and how else might we be able to do this, so that we're all together working on this and standing up a system that's going to make your life, I'm hoping, I'm not one to oversell and underdeliver. And I've said that to the vendor, I want to be able to talk about this great thing. I need to see that great thing. And now I'm gonna talk to you a little bit more about that great thing. But as you see, we're still building it as we speak. But we're trying to put in it those kinds of things and buffers that we believe will make your life a little bit easier on the other side of this, and hours on hours as well. So again, I'm going to stop. I thank you. I thank you. I thank you for those of you who have responded in the chat. Keep it going. If I can't use everybody in the first round, that's okay. Put it in there and we'll get you in the second. So again, I can't thank you enough. And I know you get tired of maybe hearing me say this, but I thank you for what you do every day for children and families around Chicago. Somebody said to me that, every day since they've been around me, that, I bring it home and drive the fact that, this is really not about me. This is about children, birth to 5, that you work with. It's about what you do with and for them. And I take that to heart every day about what you're doing to make the lives of in the children of Chicago better. They are better because they've come past your door. And I thank you for everything that you're doing every day. And as you all know, if you need me, I am here. And with that, I'm going to turn it over to the next person. So thanks, everyone.
All right, I am super excited. I don't know about you, Sarayla, but this is wonderful. I mean, all of the feedback back into the chat has been amazing, that people want to participate in this. Change is difficult and change is hard, but you willing to take this journey with us, it says a lot. I know I've seen some messages and some private messages about, yay, we're going to Salesforce, and people are familiar with the Salesforce platform. And so they are excited about what this could look like and what it can be for us and what it can do. And so we're looking forward to your participation. The more participation and buy-in we get from those end users who will be using the system, the better. I'm happy to see Catherine and others who are a part of our home visiting world saying, hey, we want to go ahead and we want to affect change as well. And we want to have a say, and we definitely want to have a seat at this table. That is great. We don't want anybody to feel left out in this realm of what this new data system is going to look like. And so we want to make sure all of our programs are represented. So I'm elated. I really am. With that being said, trust and believe we're going to be reaching out to you. So just make sure you're ready to respond to us. I want to talk about community assessment. Just wanted you to know that my team and I were working very hard to make sure that we get you a palatable document set out for the community assessment. We work with our vendor, Chapin Hall, to go ahead and update our tables. And I want to kind of go into what that looks like. It is, what you've seen in the past, but of course we get updated tables on an annual basis. And so I do want to talk to you a little bit about that. But a part of our responsibility every single year, right? We do it repetitively. When we start talking about program planning and our program planning cycle and what that looks like. A part of it is us assessing the community needs. And we can honestly say, especially going through a pandemic, that our community needs have changed rapidly. It has changed from year over year, definitely. And so we should be looking at kind of the latest and the greatest information that's available to us. And not just looking at community data, but looking at other things, right? Child outcome data, looking at self-assessment, looking at other things that we can go ahead and actually use to go ahead and make decisions about how we plan for our program. And so all programs are expected to intentionally plan, right, and implement a menu of services that will provide for children and families based on the data from the community assessment. So this is something that we expect for you to do, and it has to be intentional about how we approach this. Each of our federally funded programs, our Head Start, Early Head Start, CCP, and also expansion funded programs, they must conduct a full community assessment every 5 years, and it has to be updated on an annual basis. And so this is a requirement of the program for those federally funded. Our PFA and PI funded agencies should be consulting the DFSS community assessment. And so you guys will have access, our PFA and PI only programs, you will have access to the community data that we're going to be putting out as well to ensure that your programs do align with the needs of your community. We want to make sure that you know that there's been a major change from last year to this year. Last year, we really relied on 3 different community assessment websites to help us. Chapin Hall helped us with what we call the CNAT, right? The Community Needs Assessment Tool. And so those who've been around, they understand you had to go there for a particular data set. And then they also helped us with the Young Children in Chicago website. And then the third website was the Early Childhood Supply and Demand website. So 3 different websites that really kind of help us pull together community assessment. Last year and the previous years, I'm really, really happy and enthusiastic to say now that we're going to be sending you out information next week regarding community assessment, we're only going to give you 1 website and you can get all of that goodness in 1 website. I'm going to go ahead and do a quick screen share because I want to go ahead and kind of just show you this particular website and what you'll have access to. And we'll do this really quickly. You'll get it next week so that you can take your time and go through it, but just wanted to kind of give you some highlights here. So bear with me 1 moment. Mara, can you do me a favor? Can you stop sharing so I can share? Thank you. All right, here we go. Okay. Let's see. Can you all see?
Yes.
Can you see the map?
Yeah.
Okay,
Yes, we can see it,
great.
Tiffany. We can see
Okay,
it.
great. I'm like, I need to make sure you're seeing the right thing here. Got a lot of things open on my computer. Okay, so like I said, there's going to be 1 website, and in the website, if you look across the tabs up top, there will give you access to the community demographic information, which used to appear in a whole separate website, right? And so some of the indicators that you're able to take a look at under the community demographics will be the population and poverty. Right now, I have it selected for the entire city of Chicago. And so you're able to see that our data set is out of 193,585 children in Chicago. Okay, right now I have it, you can actually select your range. So right now it's on for 0 to 5, but if I wanted to go ahead and change that and just isolate 3 to 5, you'll see how my data set then it changes. You see the 94,206, the data set changed for me, okay? And on the other end of it, if I just wanted to do 0 to 2, then again, it changes for me again to go ahead and only speak to 0 to 2 as far as that population is concerned. So this is really good to be able to kind of look at, again, population and poverty. When we look at deep poverty, we're talking about 50% or below federal poverty level. And then the next set of data is the poverty that's going to get us to less than 100% FPL. So that 51 to 100% FPL. And then the third is still considered low income, but it's less than 200%. So anybody from 101 to 200% of FPL. So that's what you're going to have access to. Wanted to make sure that you knew that that information was going to be available to you. I'm going to go ahead and select a different indicator, race and ethnicity. And again, if you notice at the bottom, the data set changes, right? And I'm looking at 0 to 5 at this point, and I have it broken out from Hispanic, Black, White, Asian, and other. And you get to see the numbers, but you also get to see the percentages next to them. Again, just giving you a glance, if you look at the map is detailed enough where it gives you that bar graphs, you know, that chart, which also makes it easy to read if you're really into kind of reading the charts or having to see that visual for it. The next indicator I want to quickly glance at is languages. And so you'll see here, English only, Spanish, Arabic, Chinese, French, Haitian. So again, it's just another data set that you'll have access to under the community demographics. Great information. Just want to make sure that you understand that this is what you have at your disposal. You're welcome to go ahead and change, between age groups as needed or as desired for your program's needs. I'm going to go to the early childhood supply. The early childhood supply, again, is another great site. You get to see how many sites that are included. The sites that are funded through DFSS, 226. The ones that are funded through CPS, 366. And then the other sites that are funded as well. We do have information from Start Early. And so it does include information from them as well when you see other. But primarily this information is DFSS and CPS data. But you'll have an opportunity to see all of the sites. As you'll see down at the data table, you'll have EHS slots, Head Start slots, PI slots, PFA, and also the information that's available for child care. But this information, again, it is available to you, and you'll have access to the supply and demand data. The next one I want you to just take a look at is our early childhood utilization. Gives you an opportunity to go ahead and see slots that are utilized, slots that are not utilized, but this is where you can go ahead and kind of dive into some of that. To see, in your community, are needs being met? Are they not being met? Could we do more? And those types of things. We'll also have the updated data tables available for you that you can go ahead and pull down. And the indicators that will be available for those data tables will be birth data, child welfare data, crime data, economics indicators, housing indicators, and student with disabilities. So just wanted you to go ahead and see kind of what's going to be available at your disposal. We used to have this information available across 3 different websites, and we're happy now that it's all in one website. If you go up to the very top when it says select a service area, because I didn't isolate it, I did the entire city of Chicago, because as the grantee, I want to be able to look at the entire city. But if I need to go ahead and map out particular communities on the map, I can go ahead and do that. And you can select one community, or you can select several communities to go ahead and map out your desired plan when you're selecting the communities that you serve. So it can definitely be more than one if you need to. Go ahead and run and generate your report. Once you go ahead and select the different communities that you would like to run data for, then you go ahead and you generate your report right up here in the right-hand corner. And it's as simple as that to really help you kind of get some data for your community assessment. If you have any questions once we send out this information, of course, you can contact me or my staff and we'd be more than happy to assist you. But just wanted to kind of run through that really, really quick. I'm going to go back and stop screen sharing. And Marv, you can just go ahead and pull back up the agenda. So I'm excited about the community assessment just being all in one location, because going to 3 different locations in the past, it was a lot. And so we're super excited to have it all be in one location. So hopefully that's going to help in this process. We are expected to go ahead and send community assessment packages out next week. We're going to be giving you 2 weeks in order to go ahead and get that completed. And then, of course, as always, make sure that you're communicating with us if there's additional time that's needed. In terms of self-assessment, we are on track to go ahead and have the annual self-assessment due back to DFSS by April the 15th of this year. And so there are 2 required components to completing the self-assessment, right? There is the report template, and there's also the survey. We're going to need you to do both pieces in order to have a completed self-assessment. There are about 10 organizations thus far who have at least completed at least one of the components. And so I just wanted to kind of give a shout out to those organizations. You know who you are, who've already kind of dived into this work. And they're excited and on track to go ahead and actually complete on time. So we're really excited about that. And if you have any questions, definitely let us know. Be sure to follow the directions in the cover sheet. That's going to be very important to make sure that you're following those directions in the cover sheet for the self-assessment. The required components, they've been extensively shared via the CSB update. And so, if you need to kind of go back to them, go back to a previous update, you'll get what you need. Remember, the self-assessment is a great tool to take a comprehensive internal review of your organization's strengths and challenges. These findings definitely help set program priorities for the coming year and should be reflected in the agency's action plan. So all of our Chicago early learning agencies are required to submit an annual self-assessment by Friday, April the 15th. And if you have any questions, contact my staff, Berenice Vargas, contact myself, or even Martise Brooks, and we'll be more than happy to assist you. But we're super excited. We're on track for self-assessment. We're looking forward to the next self-assessment meeting. And thank you to all the self-assessment committee members as well. The next update I wanted to briefly mention, I don't have much of an update, just to let you know that it's still coming. But we did tell you that you're going to be having, for the federally funded programs, we did get some awards from the federal government for ARP, the American Rescue Plan. And that was about $5.2 million. And we also got $1.2 million in CRSA funds. So I just wanted you to know that we're in the process of working with the attorneys to get those boilerplates complete. There has been a delay, and so that's the reason why you don't have it in your possession. But I wanted to assure you that that this is being worked on. We have not forgotten about our obligations. When we said we wanted to make sure that we got the ARP dollars and also the CRSA money out to you. Both of these dollars are used, have been given because of the coronavirus and offering coronavirus relief. And so just wanted you to know that it is funds that will be coming. The ARP funds is $750 per child. It's going to be based off of your funded enrollment for federal. And also the CRSA funds as well. And CRSA is the Coronavirus Response and Relief Supplemental Appropriation that was passed by Congress. That one also, it will allow relief of $312 per funded slot. And so just wanted to let you know that it's still coming. It's just the boilerplates are still being worked on by our law department. So as soon as we have more, we'll definitely let you know. That concludes my updates. And thank you, Bernice, for putting your contact information in the chat. And so if anybody has any questions about self-assessment, you can reach out to Bernice. We appreciate it. Enrollment. So enrollment updates. I wanted to jump into February's enrollment date. So for Head Start, we're looking at, we're funded for 1,489. And so for February, we are at 1,361 enrolled. That's 91% of our funded enrollment. For Early Head Start, we're funded for 1,267. In February, we had enrolled 984. That's 78% enrolled. And for our CCP, we're funded for 1,100 slots. And we've enrolled in February 783. So we were 71% enrolled. And for the Early Head Start expansion, and remember that is the grant that is under, that we're expecting for the federal review this particular season. And so we're funded for 200 slots. And so February, we had 145 enrolled. So that's 73% enrolled. PFA, we're funded for 5,935 slots. February enrollment, 4,019 slots, 68% enrolled. PI center base, we're funded for 3,100, 2,307 slots for February enrolled, 74%. And home base, PI home base, 1,658 slots funded, and 1,191 enrolled, 72%. And our PI doula, I do want to go, I know this number is low. We're funded for 238 funded doula slots. And right now our enrollment in COPA is 33. I want to stop and pause here just to go ahead and thank and congratulate all 5 of the programs who were awarded doula. Doula is something in the past that we have not included in COPA. And this year, Craig and his team has trained those agencies to go ahead and enter doula information into the system. So this is something new. The number is really low, and normally I wouldn't get excited about having such low enrollment, but I am excited to see that we're integrating them into our data system. And obviously this is low and we have some work to do on it, but coming from where we didn't have enrollment in there at all to now we're inching up. I am happy and I'm proud to go ahead and see that. And I just want to thank those organizations who are funded by the PI doula dollars and thank them for their cooperation. Obviously, you see that there is work to do. And what I'm going to ask is that you talk with your staff who's responsible for data entry into COPA, tap them on their shoulders to make sure that all of their enrollments are going to be in here. We have some work that we need to do across all of our funded programs. Nobody is at 100%, as you can see. Rachel mentioned it during her update, but ECBG is coming to a close. And what we know is we have programs who are underutilized on that grant, not just dollars, but also under enrolled. And just remember that the program objectives should match to your fiscal objectives. And if somebody is under enrolled in a program by 68%, just using PFA as an example, if your program is under enrolled by 68%, I don't see you being able to spend 100% of the money anyway. You're not able to go ahead and meet those program objectives. So I don't see how you're going to meet your fiscal objectives. Those classrooms need qualified teachers, and just looking at enrollment that's low, it looks like to me that we have classrooms that are not filled, that we don't have qualified teachers in those classrooms. So there is no way we're going to be able to reach those fiscal objectives because the program objectives haven't been met. So it really does go hand in hand when we're looking at, expending dollars. And it makes sense to me, programs who are under enrolled, not spending their dollars. I think what we need you to do is kind of take a look at what you're doing in your house and go ahead and notify us. If you know that you're not going to spend because of various things, we don't have the qualified staff that we can charge to the grant, or, whatever the circumstance may be, we don't even have certain, full classrooms that are open. If that's the case, if that's your story, I really need you to make sure that you're reaching out to our deputy commissioner. She needs to understand, when enrollment goals, we've given you funding to open up full classrooms. And when classrooms are not open, but we've given you the funds, you really need to make sure that you're reaching out to the deputy commissioner. These are her programs. She's responsible. You're responsible at your organization. And what I don't want people to understand is maybe I've told a person at DFSS, but I need you to tell the right person. The right person is definitely our deputy commissioner. She needs to be abreast of what's going on in your house when it's concerning the funded number that you're funded for. And so things aren't matching up, as you can see here. And we do have a lot of work to do to make improvements in this area. We will be reaching out to individual agencies to go ahead and kind of give you taps on the shoulder so that we can have discussions with you. We've already started those discussions, but I'm asking you to be proactive about this. If you know that there's improvements that's needed in your house, you're not able to meet your funded enrollment objectives, reach out to Sarethel Burgess Burnett immediately. With that being said, I want to thank you, and I want to go ahead and pass it on to B.
Thank you, Tip. Good morning, everyone. I'm very excited to announce that we've been in contact with the Governor's Office for Early Childhood. As you know, some of you know, they received a grant last year or the year before to begin to work on mental health consultation. And so they'll be bringing those consultants to all of our early childhood programs. As you know, this is an area that we really need to bolster up because children are having some real challenging behaviors out there. Families need us, staff need us. And so I'm excited to say that they will begin in the spring these reflective learning groups. And in these learning groups, they've reached out to us to identify specifically facilitators who are well-versed and have the expertise, particularly in Head Start and early Head Start. So what we shared with you in the chat is a summary of the roles and responsibility of these facilitators. These groups meet quarterly right now. And so if you know of someone that would be a great facilitator and knows Head Start and early Head Start, you can feel free to put them in contact with me. And then the other update for help is we will be resuming our health services advisory subcommittees. Those will start back up in April. And so I just encourage you to watch the CSC updates to get the dates of those subcommittee meetings and the registration links. And with that, I'm going to turn it over to Angela in Hearing Vision.
Good morning. Just a few updates. Just to inform you that the Hearing and Vision team is conducting additional screenings for children that were recently enrolled and children that were absent during our initial visits out and our rescreen visits. As a reminder, we would like for the sites and the agencies to update their data in COPA to reflect the child's most recent screening results. As we're looking and trying to make sure that we are targeting all the children that needs to be screened, we're finding that children results have not been updated, and it looks like as though they were not a part of the program itself. And we know that those children were there in the beginning. Also, we will be following up on all referrals issued for this school year in the upcoming weeks. And that's it for me.
Thank you, Angela. And now Jeff for facilities and licensure.
Good morning, everyone. I just want to give everyone a heads up on making sure that when you make changes to your legal entity or your corporate strata, that you don't just do that with the Secretary of State. You need to also report those changes to your city licensure as well as your DCFS licensure representatives. If you do a change of officers, change of shareholders, change of membership, if you change the name of your legal entity or the name that you do business as, of course, change of address, all of those things need to be reported to both the city and the state because it changes the nature of your licensure. All of that is recorded in our databases. And when you change it, it in effect invalidates your licenses. So if you're ever in any of those situations and you're not sure if you need to report or what you need to report, just give me a call, and through a series of questions and answers, I'll be able to tell you what kind of applications you need to do to have those changes take effect on both the city and the state level. One very, very big thing to remember is that if you change your federal employer identification number, you've in effect changed the entire legal entity. You've changed from one legal entity to another in most cases, and licenses are not transferable. So most of the time that means that you're going to have to apply for a whole new license under that new legal entity. So please be aware of those things as you make those changes. Just report them to us here at DFSS and as well as to DCFS, and we'll guide you down the path of making sure that changes are done well for your licensure. And I'll put my contact number and email in the chat box. Thanks, B. Next.
Thank you, Jeff. And then next up, Disabilities Chief. Gina, I bet you're on mute.
Thank you so much. I'm so sorry. Good morning, everyone. Thank you, B. Just a few disabilities updates that I'd like to share with you today. First, our team is providing individual child observations to your programs when there are questions or concerns about whether a child needs a referral to Chicago Public Schools for evaluation. And so we are continuing to conduct those observations in person or remotely based upon what's happening at your programs. We are also receiving 100% of your children's referral packets to Chicago Public Schools and providing tech support to your disabilities coordinators, your ed coordinators, to ensure the packets are comprehensive and contain all of the documentation that's needed by our CPS citywide assessment team. We are also participating in the children's evaluations at Chicago Public Schools to provide advocacy and support. And to ensure that the team is aware of the dual enrollment option so that children may be served in our community-based organizations and then also attend Chicago Public Schools and to receive transportation to and from our CBOs. In addition to that, we are continuing to receive requests for support with regard to school assignments for children. We know at this time of year that many classrooms are full or at capacity. And so your DSCs can reach out to our team, our subject matter experts, if there is a case in which a child is in need of a school assignment or the parent is having difficulty enrolling the child. We would recommend to reach out to us. Transportation is still an area of concern. We're kind of chipping away at it, dealing with issues on a case-by-case basis. One of the last conversations that B and I have been involved in is whether or not we have parent consent to transport children in non-bus vehicles. So some of our children, parents have verbally approved CPS transporting by non-traditional means such as Uber ride shares or flash cabs. And so it's been a higher level conversation with leadership at DFSS and CPS about what that looks like. Particularly as it impacts our children and our Head Start funded children and frankly, all funded children. So just wanted you to be aware of that. Also, we are at that time of year when we are looking to summer assessment, meaning that children who have been referred to Chicago Public Schools this year, who have not yet been evaluated, they are in queue, if you will. And so we will be sending messages out to your disability service coordinators weekly now via email, and we will let them know what packets we've received for children and where they are in the queue and what might be missing information and so forth. So that should be helpful. The deadline for all outstanding and new referrals for children to CPS this school year will be April 30th, 2022. So we are advising the disability services coordinators to ensure that all of the children's outstanding and new referral packets be submitted to our subject matter experts by April 30th. And again, that will ensure that they're evaluated this school year or over summer assessment. Finally, we just want to share that our next CPS Saturday assessment is on March 26th. And the great news is that when we're calling to schedule families, they have lots of options. So during this time, they are still able to take an in-person evaluation appointment, or if they prefer, they can have a remote or virtual evaluation of their child. What we are seeing is that with a pandemic, the COVID numbers being down, more families are feeling comfortable to come in person with their child. We are still operating in a reduced capacity. We're limiting the number of people in the evaluation room. So we are asking only one parent to accompany the child in person. And then all of our community-based organizations participate remotely in the evaluation with parent consent. And then finally, parents are given the option of having a Saturday assessment. It's one time per month. If they prefer that, that's also a great option. We are still conducting at 2 evaluation sites, Garfield Park at 2651 West Washington Boulevard, and the second site is at Garfield Park, which is at 4655 South Dearborn. And then last but not least, B and I would like you to know that the memorandum of agreement is coming soon, right, B? So we'll be excited. It is being routed for signature, so be on the lookout from that, from Sir Ethel, from B, and hopefully in the CSD update too, right, B? And I think that is all.
Hi, will there be a like a flyer or a toolkit at all that we can share with parents with those key dates and locations?
I'm sorry, with the evaluation dates and locations?
Yes. Mhm.
Okay, so I can definitely follow up with you offline. It is not a walk-in clinic, and so it is by appointment only, but I can definitely give you that information and
Yeah,
tell
that would
you
be
more.
great.
Okay, great. I'll put my email in the chat.
Okay, wonderful. Thank you.
Thank you.
Thank you, Gina.
Thank you, B.
Thank you, Catherine, for the question. And up next is Kwame. Well,
Thank you, B. Good morning, everyone. A few updates from our Quality and Program Development Unit. As it relates to our class observations, I recall putting in our CSD update that they were indeed in person, and I wanted to bring that to this platform to communicate that, again, our class observations for this program year are conducted in person. It is our statement and it is our narrative to our observers to enter and maintain their being masked up while in our facilities conducting the observations. And so right now we have had word that 3-week windows are being issued. Our request is that you please work diligently with our providers over at National Louis University, who will be reaching out to, if not already, will be working to solidify your 3-week windows for your programs. I'm just reminded about our teaching strategies platform. This program year is moving by pretty quickly, and just wanted to put a reminder out to ensure that your education team is still entering observations as we're approaching yet another checkpoint season shortly but surely. Professional development, just want to remind everyone to please register for those trainings via COPA. I know we posted recently in our CSD update an upcoming quarter worth of trainings. And anytime there's any special trainings like the ones we conducted this these past 2 days for our ECBG, thank you to everyone that attended. Those announcements do come out via a news blast similar to the CSD update. So please be on the lookout for those opportunities. And also lastly, parent engagement. One of the things we wanted to call back to your attention is the use of our Ready Rosie curriculum supplement for our parent engagement in connection with our TSG and creative curriculum. I have my supervisor Tamela over our quality unit has posted in the chat a link. We're looking to a link to a survey in which we're looking to gather up-to-date information on your family support workers for our agencies that are housed on our Teachstone Teaching Strategies platform. We ask that you access and share this link or complete this survey or forward it to one of your administrators to ensure that this link is the survey is completed and handed back and returned to our team by next Friday's date, which escapes me at the moment. Apologies for that. So yeah, we're looking for the survey to close next Friday, the 25th. That's March 25th is the survey will close. And then we'll be hosting another Ready Rosie kickoff event so we can give more information and how to actually use and manipulate the Ready Rosie system. That wraps our updates. I'll check the chat for any questions we have. And that being said, I'll go ahead and throw it over to Ms. Elaine, who will take care of program operations. Thank you.
Thank you, William. Good morning, everyone. Just want to let you know that our program operation teams will be resuming their on-site visits this month. So they will be contacting you to come out and I like Sarato's term, put eyes on your programs. And with that being said, I just want to give you a brief overview of some of the items and data that we utilize to monitor your respective programs. We look at your narrative and your grant goals, and for our PFA, PI agencies, we look at your scope of services to make sure that you are implementing programming as it relates to your contractual agreements. We look at your annual self-assessment that you completed from last year into this program year, your priority area plans, any corrective action plans agencies may have, stemming from incident reports or complaints that may have been submitted to HHS that we needed to follow up on. We look at some systemic issues from our monitoring that we've done throughout the program year. And then we also utilize our monitoring reports and any reports, COPA reviews, teaching strategy goals, benchmarks, color bands, et cetera, and your program policies and procedures and communication documentation and other monitoring tools as applicable. Just wanted to give you this list so that you can refer back to it as it relates to what you're doing in your respective program to ensure the quality services are being provided to the children and families, and that you are meeting the compliance benchmarks as it relates to the performance of your respective agency. Next slide, please. We also utilize this information as we prepare for our agency roundtables. And our agency roundtables will be conducted this year from June 6th to June 17th. And what you need to know, and this is for all of our Chicago Early Learning programs, is that you will be sent a letter from the team lead supervisor, Jacinta Passament or Nicole Randolph. It will give you the date, the time, and whether your roundtable will be on site here at DFSS or if it will be a virtual session. What you will also receive is a program year monitoring assessment report. And it will talk about your strengths, weaknesses, and any performance concerns that we may have, as well as any systemic that we want you to consider into the new program year. The CSD representation comes from all three of our units: program operations, program admin, who will talk about your fiscal and contractual pieces, and program quality unit, who will talk about your professional development feats and things like that. And then other information that's deemed applicable by DFSS. And so when you come to the table, we want you to come prepared with documents and updates, discuss your priority areas for the new program year 2022-23. Your priority areas action plan update, which will be discussed in June, your implementation plan update, and your self-assessment report from this year, any findings and action plans, and any other supports that you may need from DFSS. And so I share this information at this time here is because I want you to begin looking at where you are and what your internal monitoring is yielding about your performance and quality compliance. So as our teams go out, you know, they will make sure that you are functioning and making sure that we are addressing your issues and concerns and any issues and concerns that we may have as we also begin to prepare for our staffings, which will tie into your roundtables for the end of the program year. And so that concludes my report, and thank you.
Hi, good morning, everyone. I'm Nicole Roberts, Director of Accounting, and today I will be providing you with the fiscal update. As Tiffany mentioned earlier, the under enrollment is reflective out on our current expenditures. We just made it through the first quarter of our federal grants, and Head Start is currently at 8% expended. Early Head Start is 5%. CCP is 1% and expansion is 7%. So I do want to encourage your teams to often analyze your budget to actual expenditures and determine any need for reallocating your budgeted dollars to ensure that you can utilize those dollars as needed. Next slide, please. For our state funded grants, we are almost 3/4 through these grants that end in June, and we are currently at 30% expended for ECBG and 28% for childcare. For our FY21 closeout, the voucher audit team is currently closing up their voucher review for that period. We currently have about 39 invoices in queue. Once they clear those invoices, your finance accountants should have already reached out to you in regards to de-obligating those contracts and confirming your invoice totals. And so once we get through those invoices, we will be de-obligating those contracts. For FY22, you should have invoiced through the period of February 28th for all of your budgets. Please continue to submit monthly. I know that there is delays with our voucher audit process currently due to the influx of vouchers for the FY21 closeout. The voucher audit team is working as best they can with cycling times close to over 40 days on many invoices. The same as across all agencies, they are currently understaffed and they're working on invoices first in, first out. If you are experiencing any cash flow issues, please reach out to me and then I can work with them to see if we can get those expedited for you. But if you have vouchers in queue, don't let that stop you from continuing to submit invoices for the following months. Again, just another reminder to review your budget to actual expenditures and get those budget revisions in as needed. For the state funded grants, you should also have your invoices submitted through February 28th through the end of February. Another reminder for ECBG, the budget revision cutoff date will be May 13th. So please keep that in mind as you're reviewing your budget to actual expenditures and ensure that you get those budget revisions in as soon as possible. And please be mindful of that date because that does impact your ability to submit your final vouchers at the end of the budget period. And then I just have on this last slide, again, the reference materials for iSupplier and then your finance, your contacts for based on your program needs. If you have any questions, please reach out. Thank you.
Can we go back to the slide where we had the ECBG funding that's been expended thus far? One more. One more. Right there, thank you. If we're looking at this slide and we're thinking about where we are, and if you're the funder and my team and the finance team are communicating with you and your concern is under expenses right now, what they're looking at and what they would be seeing would be approximately 70%. And when you think about it, if we've expended 30%, that means we're leaving 70% on the table. I do know that there's invoices in the queue. So I'm not arguing with that. But what I am saying to all of you is we have only 3 more months in this fiscal year And our funder, CPS, has to make a determinant about moving dollars around. For example, PI funds that are not going to be expended, they can do some movement so that they can utilize those on PFA. Please understand, we cannot be this underspent and still have this grant. I'm going to say it again. We cannot be this underspent and still have this grant because, again, we are leaving too many dollars on the table right now. And I know the 30% does not represent everything that's in the queue. I get reports, I can see that. But I also know that everybody who has talked about a budget revision hasn't done one. You've just been given a date of May to do a budget revision. Let me say this to you. If you're thinking about a budget revision, I need it now. I need to be in conversation with you. As Tiffany said, you need to be talking to me about what it is you're planning to do, because I, Sarathel Burgess Burnett, Deputy Commissioner in this chair, I'm going to have to make some very, very difficult decisions about this fund and what we do, because we cannot do this. For those agencies who are expending, they should not be impacted by those who are not. And I understand the difficulty. We are still in a pandemic. I understand all of those things going on. But if you don't talk to me and you don't work with me, then we're leaving it where you are on a certain date. And I'm not saying a date today, because I'm going to give you a chance to talk to me. We're going to have to make some determinants about whether or not we leave these funds in that same contract, or do we attempt DFSS to make sure that we're able to do some of the things that we know need to be done for children and families around Chicago. I can't leave dollars on the table. My job is to be, a good steward of dollars. I have been sitting in this chair for 4 years now. The first year we were under expended by about $8 million. It went down to about $4 million the next year. And some of you, I was on the phone with you then, and then we ended up in a pandemic for the last 2 years. We have underspent. I get really, really emotional over it, because I know you need these dollars, people. I know you need them in your house. You need to be paying salaries. You need to be doing things for your staff. You need to be doing things in your facilities. You need to be doing things for the children and families. But we're in a position where these dollars are constantly being given back to the state of Illinois. And if we're saying we're giving it back, then what it looks like is we don't need them. I don't agree that we don't need them. I don't agree that you don't need them. But in order for me to step in and do something different, I need you to do something different. I need people to be expending these dollars. I need you, as Tiffany asked for, reach out to me, your deputy commissioner, who has a responsibility for this grant, and talk to me about what's going on in your house with your early childhood block grant. I know some people have already expended all of their dollars already, and we're not at the end of the year yet. I know some of you have very little expenses on yours right now, because I'm pulling reports and we can see that. And I need to understand why. We have been asking consistently for monthly vouchers and invoices to go into the system so that we can see where you are. And there are people who have not invoiced in months. And I need you to get your information in there. And I can see someone asking in the chat box, how do we get get information about our invoices from January, February? If you got things sitting in a queue, contact Tiffany, contact Nicole, as she just said to you. We want to help. That's what we're here for, is to assist. But when it comes to leaving dollars on the table, I can't sit here another year and allow it without saying that we're going to do something different. And I don't want to impact someone unnecessarily, but if no one has communicated with me and said exactly what your plan is and have not worked with me, then I'm going to have to work with you and give you what it is that I believe we will be able to do going forward. I don't try to have these conversations in open public like this, but I'm doing it because we've been doing this for months in our EDPDs and putting these numbers up there. And it is March 17th of 2022, which means we're halfway past the month of March. We only have April, May, and June left, with $70 million based on this number in front of us, still on the 70% of these dollars still on the table. There's something wrong here, people. I'm sure if you were sitting in my chair, you'd be saying it, you'd be seeing it. Believe me, our funder sees it, and our funder wants us to do something different. And I will be doing something different with some of you because I have to, but I need to hear from you what you need so that I can work with you. And I guarantee you, if we leave these many dollars on the table, it's no longer in my hands. I won't have the ability to work with you at that point. what we will be doing is hearing from our funder what choices they're making over these dollars, because their responsibility and their fiduciary responsibility over the full grant for that CPS receives is to make sure that this isn't happening year over year. I'm giving you this because I want to work with you. I want to work with you. I want to work with you, but I need you to work with me. I need you to communicate with me so that I can understand. I've reached out to some people. I've received letters from some folks. They've given me a plan. Everybody has not. Again, I'm saying it here today, and I'm giving you an opportunity to reach out to me via email or call me, and let's talk about what it is you're going to do with the dollars that you have in your current grant. Specifically, I'm talking about your early childhood block grant, which would be PFA and PI if you have both, or if you have PFA, no PI, it doesn't matter. Whichever one that you have for this block grant, I need to talk to you. With that, I'm going to get off of my soapbox, and I've been minding questions in the chat throughout. I don't see any additional ones coming in right now, but if you need anything, I'm here. I need to hear from those of you who are underexpended, and you should know where you are on your current ECBG grant right now. And you should be able to say to me what it is that you need and what you'll be able to expend. To Tiffany's point earlier, what she said is actual. If you are under enrolled, you're not going to be able to use your current full grant. Let's talk about what you're going to be able to do, and let's talk about what it will look like for your organization, so that we will be able to work with you right now before we get to a point where we are told, stop, DFSS, CPS needs to now do its work with this grant. Work with me. We only have a couple of weeks left, people. I'm putting my email in the chat box right now for anyone who does not have it, so that you can reach out to me and we can talk. If anybody wants to unmute, if you have any questions, let me know.
Is there any possibility, I don't know how flexible the funds are, but if a PI program is underspending and they say there's no way we're going to be able to, spend this amount of money or whatever by the end of the fiscal year, could that be reallocated to a different PI program or agency that is spending or is like overspending?
I will tell you right now, we're going to be looking at what we can do across the fund to try to get all of the dollars into the hands of those who can use them. Is the best way I can put it right now. That would be my goal. That's why I need to hear from people. If I have someone who, for example, is fully enrolled and who has, expended all of their dollars, and, we're 3 months out and they have a need, I'm going to be thinking about needs. I'm going to be thinking about how I can get these dollars out of the door into the hands where we can be serving children and families. Again, I just need help from everybody. I need people to communicate with me. I've put my email address in the chat box, and everybody please feel free to reach out to me so we can have discussions about this. And again, as Nicole said, if you have invoices in the queue that are sitting there and have not been moved on, please reach out to Nicole Roberts. She's got her email address in there as well. So that we can get some things moving. If we need to request that something be expedited on your behalf, we've done it before, we'll continue to do that. Again, what I want to say again is, and I know this voice right now sounds like I'm, pushing, and I'm pushing because these are dollars that I know you can use, people. And I really don't want to have them turned back. So I need help. But what I need you to understand is that's what we're here for. This team, Children's Services Division, we're here to support you. We're here to be with you. We're here to help you. Our hands are tied because dollars are in your contracts until I know what is happening with your contract. I can see the dollars that are not going out the door. And we have to activate a plan right now on what we're going to do. And that's why I'm speaking to you this morning about this. Tiffany just put a comment in here to everybody. If supplemental funds are needed, please contact us. And they have to be considered. And the first, of course, priority is health and safety. There are things that we can do, but again, my hands are right now at a point where I'm looking at 30%. I'm looking at the need to get dollars out of the door, and I want the dollars to go where the dollars are needed. And those are the kinds of things that me and my team are going to be working on. Is anyone else unmuting? Can you see any others before we give people time back in their day?
There were a couple of questions asked about home visiting and the site visits, or there was one question that I don't think got answered. I think Catherine asked it. Will there be site visits for PI, standalone PI home visiting?
Yes, thank you. I did respond in the chat.
Oh, sorry.
No problem. Yes,
It's a
for this
little busy.
cycle, I understand. Yes, at this cycle, for this cycle, we will not be conducting any PI programs for the observations.
For observations, but what we're doing on visiting, my team, they're prioritizing certain organizations with home visiting. We do need to know what and where everything is happening. We need to know for social, for socialization spaces and everything that's going on. So will there be visits? At some point there will be, and my team is working on scheduling all of those as we speak. Question about any word on 2022-23 program year start date. We do know that CPS did put some information out to parents and others, asking them about a start date. They had a projected start date, which actually was a week earlier than they were. They were putting it out, asking parents. And so we're still waiting on confirmation of what date CPS will consider its beginning of its new program year. And so as soon as we know that, we'll get that information out to you. Will there be a notice of funding for DFSS for 2023? We are in 2022 and getting ready for multiple things, one of which is we're thinking about what we need to do as far as an RFP, because if you remember, the current contracts go through 2024. And so, yes, we will be working on notifying and getting information out to our funded partners for 2023 for start dates of 2024. And that is considering, and that's the answer regarding the question for both you, LaShonda, and also for Catherine. This is about our next RFP. Again, our current contracts for funded programs, center-based, and across our funded agencies, those contracts go through 2024. So we would have to have something on the ground for 2023.
I have a question about the sales and the salaries based on the different levels that was put in the sales with, level 5 teacher, this family services and all of that with the salaries. And some agencies, no longer have both programs to support those salaries. Are you all looking into that as to how you can help support agencies to continue, to pay those rates when if you only have one program, it's kind of hard to pay those kind of salary rates, or just looking at both pieces, the salary and the level requirements, especially with the market being how it is.
Okay, could you bring down this slide for me, Mara, so I can see who's talking? Bring down the presentation.
It's Rania from El Valor.
I thought that was your voice. Wasn't sure, Rania. But let me say this: we're doing an assessment. When we wrote our RFP in 2019, we were not where we are today. When we wrote our RFP in 2019, nobody could have predicted a pandemic. And definitely no one could have predicted that we'd be here still in 2022, talking about something that started early 2020. If you think about it, it was this week, a year ago, where my staff and I were sent home due to the pandemic. And so we are sitting here today having a conversation with you where just several years ago, everything just went belly up in the nation, but it definitely went belly up when it came to the work that we do for multiple reasons. Number one, because when we got ready to reopen, one of the things we wanted was to still have our staff base. We don't have all of our staff. Many of you are struggling with staff, period, right now, regardless of credential, because we don't have just a full loaded complement of people with degrees and credentials across Illinois and across the nation. And so we're doing an assessment now of where we are so that we can make some determinants about what our next statements will be about what we're requiring. But I'm going to say this, and I'm going to stick to it no matter what. One of the things that we have to do in this field is we have to do something about compensation for staff. Because at the end of the day, we are in staunch competition across the city of Chicago with everybody else. And when you're thinking about it, if we can't continue to move salaries in a direction where our staff are receiving a salary commensurate with degrees that we're asking them for, we're going to lose those individuals because they have a lot of other options. One of the things we know right now, there are big box industries all around us that are paying more. And they have more flexibility and they have greater benefit plans. And so we are in a serious competitive area right now just for human capital, just to have people in our classrooms. And I recognize that. And that is one of our issues. And I know that's in some cases one of the issues with underspend as well. And I've stated that to our funder. I recognize those are issues. We are looking at it. We're making an assessment. We will be looking at how it will be phrased in the next iteration of this RFP. But will we just completely say we're not going to have any credentials? We have some that we are required to have because of funding. Head Start has a requirement. Also, PFA for that lead teacher has a requirement. And so I can't go further than those because those are requirements. But we really do need to think about, in every other area, what might we be able to do? I know we've been putting money into our scholarship and trying to get more and more people to get credentials. And I thank all of you who sent teachers through, who've been able to get your family support staff credentials and all of those kinds of things. And so we're going to continue to do what we can do to assist. But we also have to say that there's some parts of this that we can't come down from because the funder requires it. But then we can think about what else we do around that and how we can continue to support. We're looking at, and everybody's looking at and Don has a question in the chat box regarding requirements for assistant teachers and PI, PFA, and we're looking at that as well. Again, we're looking at it because we need to do a full assessment and make sure we're requiring the correct and that we're making sure that we're looking at it across the board. Where there may be some leverage or some room, some wiggle room, we're going to be acknowledging that for people. But again, wiggle room at some point is going to go away. The requirement right now, this is a bachelor's degree with the ECE level 5 is only until 2024. We're in 2022. It's going to go away soon unless ISBE triggers it again and says we understand that we need to work with the workforce one more time. And so there's a lot of discussions around the city and the state right now regarding all of this. We're mentioning it here at this table, but it's going on around the state because this is a crisis right now that we're in. We're in a staffing crisis. I can't put it any other way, knowing what's going on in our agencies, specifically those that we fund. Zuli, I see your name up on the screen. Did you have your hand up? Did you have a question? The question, the BA level 5 is for a teacher in a PFA classroom. Currently, they are allowing us to have a teacher who has a bachelor's degree with a level 5 ECE credential can be identified as your teacher of record in a PFA classroom. Currently, it is accepted through ISBE out there, and that's what I'm speaking to is for the teacher, not the teacher assistant. As far as a program year end date, I understand that CPS ends June 14th. Our contract has you going through June 30th, and we will give you more information about June 14th because again, I know CPS had some closures. We want to make sure that June 14th date stays steady. Seeing no other questions, not hearing any other voices, and I'll hesitate for a moment. All right, everyone. And I'm not one to keep you on. I'd love to be in your presence but I'm not going to hold you longer than we need to. It is 11:36. And I want to say thank you to everyone who joined us today, everybody who gave up time, because I know how busy all of you are in your work every day. So I thank you every time you join us. I hope that you've gotten information today that is helpful. And I do want to end where I started, and that is, we are in a place right now in our world and in our city where we're all impacted by devastation on a daily basis. I ask that you be good to yourself, be good to your staff, be good to your families, and please, everyone, stay safe and be well. Thank you.
Thank you.